What is AMD? AMD is a leading cause of vision loss in Americans 60 years of age and older. A degenerative eye disease, AMD affects an area of the center of your retina called the macula. This can cause blurring or distortion of images and may lead to loss of central vision. Now, there are two types of AMD, dry AMD and wet AMD. Dry AMD is the most common form of the disease, accounting for 90% of all cases. All AMD starts out as dry, which occurs when yellowish spots called drusen start to accumulate in the macula and increase in size and number. Drusen can cause a slow deterioration of the retinal layers that support and nourish the light-sensitive cells in the macula, causing a mild to moderate loss of vision over the course of many years. Although possible, it's uncommon for dry AMD to result in severe vision loss. Now, wet AMD is the less common but more severe form of AMD. It accounts for 10% of all cases. In wet AMD, abnormal new blood vessels start to grow under the macula. These fragile vessels leak blood and fluid beneath the retina, causing it to swell and scar. Wet AMD progresses far more rapidly than dry AMD, with more severe effects. Bleeding, swelling, and scar tissue accumulation can lead to significant disorganization and scarring of the macula, resulting in severe central vision loss. Fortunately, there are effective therapies for wet AMD. How does AMD affect vision? AMD can affect your central vision, which is what you need for reading, driving, recognizing faces, and other things that require sharp, straight-ahead vision. In the early stages of dry AMD, there are often no symptoms, and in most cases, there is only a mild loss of vision over a period of many years. If advanced stages of AMD develop, particularly in the wet form, straight-ahead vision can be drastically affected. Common symptoms of advanced wet AMD include distortion, blank spots, and sudden decreased central vision. If you have lost significant vision due to AMD, low vision devices and other techniques may help you adjust to these changes. Ask your doctor for more information.